Here's another case. This is just looking at Endplate preparation, and in looking at, this was a study that was done where they had surgeons come in and do different passes with their standard tools. This was 10 device passes with the Dreal. You can see the amount of discectomy and then Endplate preparation that you can see with the standard tools. This was 41 device passes, and you see less bony Endplate. Over here, you see more divot in the Endplate, you see more remaining disc. But this is, this is a cadaver bone, of course, so it's a little different, and there may be quality between them, et cetera, et cetera. But I think it just does highlight that there is something to the use of the Dreal when you're doing a discectomy, when you're doing the cartilagenous Endplate preparation. So I think that there is something definitely to that. And then I think there was one more video or a case report here on that one. But the thing that impressed me when I've tried this is how far you can reach all the way through. You can basically touch every part of the Endplate, assuming you've done a good discectomy with removal of all the disc material. And that's, this is a really good example of kind of what that looks like there. And again, down here, decompressing. Looks like they're getting, I don't know what's happening here, centrally maybe, and then you can probably pull it up, but they might be going out the other side in an open setting and preserving the bone there. I think that might be what's happening there. This shows, bone growth around the cages, showing a fusion that occurred after using the device at L3-4 for a TLIF. And then this is a L5S1 case with a TLIF. And again, you can see there's some bone growth there. Looking at the cost, this was a study that was done, looked at OR time, blood loss, length of stay, complication readmission, and it was Dreal versus control, so cases that just didn't have the Dreal. And you show an improvement in the, basically when they looked at the cost and then the cost of the OR time, and then I'm sure had a statistician look at it and make sure that it all made sense. You could come up with a dollar figure in both the US and Israel. And that was sort of the overall projected cost savings. And I think depending on how you're using the device and depending on your hospital and your pricing, et cetera, there's a lot of variables here. But I think the message is kind of the same, is there is a cost savings, and this would be probably a good paper to print out if the hospital was giving you a hard time about pricing. The hospitals that I've used this at they never brought up the pricing because it wasn't a huge expense. When you look at all the things that come into the case, I mean, all the disposables and all the wild little things that you didn't realize were so expensive. You start to look at the number by number, it adds up, and this really doesn't. It doesn't even compete with some of the products that we use that are disposable. And then this is an outcome, component of that, looking at post-op pain, surgical site infections, number of device passes. So, it does work.